read. America, the land of the free, right? As Americans, we value our freedom so greatly, you can hardly associate the word freedom without thinking of this great nation. As a progressive nation, our citizens like to think we are leaders of the world. But what if I told you we still practice outdated and somewhat sacrificial rituals today in 2014? Have you all heard of female genital mutilation or female circumcision? What words come to mind? Are you thinking barbaric, painful, a human rights violation? Female genital mutilation is normally performed in some Indian and African cultures. But did you know that it has only been illegal in the U.S. since 1997? That's right, most of us ladies in this room could have been legally circumcised at birth if our parents consented. So just because something is legal doesn't make it right, does it? I'm sure we can all think of instances in which morality and legality are not mutually exclusive. So that brings us to a lesser-known human rights violation, yet it is of the same degree. Every year, hundreds of thousands of baby boys in the United States are victims of routine infant circumcision or male genital mutilation. According to the Journal of Boyhood Studies, 117 boys on average die as a result every year. This cosmetic procedure is performed generally in one of two ways. The first method uses a Gomco clamp. The second is called the Plastibell method. They are equally as painful and both involve cutting of the foreskin as well as using an instrument to crush and tear the foreskin from the glands. The foreskin is adhered to the glands in the same way that your fingernail is fused to your nail bed. Tearing away the foreskin would be similar to tearing off your fingernail. After the foreskin is torn from the glands, an incision is made in the foreskin. With the Gompo clamp, the foreskin is cut around it and fully removed. With the Plastibell method, a cap-like device is placed over the glands and under the remaining foreskin. It is then tied tightly, and the remaining skin will eventually die and fall off. Sounds quite painful, and it is. For most circumcisions, adequate pain relief is never provided. Oftentimes a pacifier dipped in sugar water is all that is offered. If you've ever had surgery, you'd probably be terrified at the thought of being given sugar water as a pain reliever before being cut into. Sometimes a numbing cream is applied, but this cream is ineffective at numbing this area completely, and it poses its own set of safety risks. If a lidocaine injection is used, often it does not completely block the dorsal nerve, and the surgery is generally already over before the anesthetic has had a chance to take effect. The risks associated with this surgery are pain, feeding issues, bleeding, infection, adhesions, breathing difficulties, pulmonary disruptions, vomiting, partial or total loss of the penis, hemorrhage, shock, and even death. According to doctors opposing circumcision, it only takes 1 ounce of blood loss in a newborn for hemorrhage to occur, and 2.3 ounces for the baby to suffer hypervolemic shock and death. Oftentimes the baby will bleed out, and it goes unnoticed due to highly absorbent diapers, and it can happen very quickly. Post-operative care involves applying Vaseline at every diaper change and checking for signs of infection and distress. Many parents report that their baby screamed in pain every time they wet or soiled their diaper. This can last up to a month during the healing process. In Western culture, circumcision is done by removing most, if not all, of the foreskin. This would be nothing like in ancient times where only a small cut was made into the tip. If full removal of the foreskin were done then, surely the majority of males would have all died from such a wound when antiseptics and antibiotics were not readily available. Removing the whole foreskin in this manner was brought to popularity by a man named John Harvey Kellogg, yes, the cereal guy. According to History of Circumcision website, in the late 1800s, Kellogg believed that circumcision would stop a boy from masturbation because of the physical and emotional side effects. It was also touted as a cure for rickets, epilepsy, and even TB. Of course, we now know that this is not true, but there are some other myths surrounding foreskin and circumcision that exist today. One would be hygiene. You'll often hear that circumcision is cleaner. The prepuce is actually a self-cleaning organ and is designed to keep harmful bacteria out. All that is needed is a quick rinse in the shower once a man reaches puberty and is able to pull back his foreskin to clean under it. Until then, only wiping the outside will suffice, and a boy should never be forcibly retracted to clean under it. Any man, circumcised or not, will need to clean his nether regions. And when a child is in diapers, the exposed opening of the glands along with a wound so close to feces is definitely not cleaner. Another myth is STDs. We hear that men are at an increased risk for STDs if they are left intact. Yet if we look at the STD and HIV rate in the U.S., it is actually quite high. It is higher than other developed nations who do not routinely circumcise males. All that is needed is a quick Google search on STDs to see hundreds of pictures of circumcised males with sexually transmitted infections to see that circumcised men are still very much at risk. This method of thinking is very dangerous and can lead to an increase in disease among circumcised men who mistakenly believe that they are protected. The only safer sex is to use condoms with a monogamous partner. Some adult male side effects to circumcision would be having too tight erections, painful sex for their partner due to friction, dryness, desensitization, taking too much skin, botched circumcision, skin bridges, negative feelings about being forced through a surgery they did not consent to, and partial or total loss of the penis and erectile dysfunction. There are definitely benefits to staying whole. 20 square inches of skin remains on the penis for gliding and protective purposes. Increased sexual pleasures for both partners, protection from desensitization, the elements, and the right to bodily integrity. Circumcision is a business in the United States. No one makes money on a whole person with correct functioning. Someone is paid to remove the foreskin. Someone is paid when the foreskin is sold to pharmaceutical companies. Someone is paid every time a bottle of face cream, lubricant, or Viagra is sold. Circumcision is a for-profit organization, and baby boys and their parents are the victims. Thankfully, Americans are becoming educated on this outdated and painful procedure and demanding better for their sons. Circumcision rates have now fallen to less than 40% of boys being done in the U.S. and is on the decline. A circumcised boy will now be the minority and his peers will be left intact. We should all say no to routine infant circumcision and yes to honoring our son's genital integrity, safety, and respect as human rights. Males deserve protection under law just as females do from genital cutting. It starts with us being a real progressive nation. We the people have the power to give our sons freedom of choice. Thank you.